So today's Lunch and Learn session 19 is on sleep, movement, and chronic pain with Dr. Daniel Wibley. Really quickly, my name is Tiffany, and I'm a study coordinator at the Publicly Engaged Research Corps. We are a group within the Chronic Pain and Fatigue Research Center at the University of Michigan that focuses on elevating the voices of patient communities in research in order to raise awareness about health inequities and community needs. So together, myself, our director, Rachel, and our project manager, Vivian, work to bring events like this to the community. I'm here with Megan today, who will be helping me monitor the chat. So for any of our online attendees, if you have any questions, feel free to put them in the chat or raise your hand to be unmuted and contribute to the group discussion. The Publicly Engaged Research Corps is part of the Chronic Pain and Fatigue Research Center, or CPFRC for short. The CPFRC at the University of Michigan is a world-renowned research center composed of investigators, clinicians, and researchers who study the mechanisms and most effective treatments for chronic pain and fatigue, including any conditions that have chronic pain and fatigue as core symptoms. We aim to do a couple of different things, including improving the understanding and management of chronic pain conditions, as well as providing current evidence-based information to the public. We don't only study people with diagnosed pain conditions. Instead, we're interested in anyone experiencing chronic pain at all. And with that being said, I'd like to introduce our guest speaker for today. Dr. Daniel Wibley is an assistant professor in the Department of Physical Medicine and Rehabilitation at the University of Michigan. He has clinical experience in managing patients within rheumatology, and his research is focused on the intersection of sleep health, chronic pain, cognitive function, and physical activity. So please welcome Dr. Daniel Wibley. Sorry, technical difficulties. There we go.
Thank you very much. So good morning, good afternoon. I'm Daniel. So you would like to introduce myself so you know who is speaking. I'm originally from London in England. I trained as a physical therapist there. And then I moved to Scotland to do my PhD, which focused more on clinical research. Then I moved to Michigan, to Ann Arbor, to incorporate sleep health into some of the work that I was doing in pain research. And after working at the University of Michigan for a while, they decided to keep me. So I'm still here. I've been asked to come to speak to you today to talk about sleep, movement, and pain. This is my area of main research interest. And in the talk, I'm going to focus mainly at the start about sleep. It's something I'm really fascinated in. It's something I really like to share with people about some of the details about sleep. I'll then talk about the relationship between how we sleep, how we move throughout the day, and why I think it's really important that we balance those two things in order to help us to manage our pain. I'll then talk about how that research has informed a new intervention that I've developed, which focuses on both improving sleep and improving how we move throughout the day at the same time. And there's a flyer about that at the front called the Move and Snooze Study. So help yourself and share widely. So, as I mentioned, I'd like to talk about sleep. And I think about sleep a lot. I just wanted to check in with everyone in the audience. Who has problems with sleep? Does anyone have issues with their sleep? So nearly everybody. For me, it's fascinating because we go through this strange ritual every night of going to sleep, maybe dreaming, going to different stages of consciousness, waking up the next day, acting like it never happened, and doing it every night. So we've got this other world going on that we live alongside. And so that led me to want to investigate more into what's happening when we are sleeping and why do we sleep. Well, we all have our own circadian rhythm. So this is like the kind of ebb and flow of our wake time and our sleep time. So we oscillate between being awake and being asleep every night and every day. And the word circadian rhythm, I don't know if you've heard it before. Yeah, but it comes from the Latin circa, which means about, and diem, which means a day. So about a day. And that's because the circadian rhythm that we have, which talks about how basically how much we're awake and asleep, is around 24 hours. So it matches the Earth moving around the sun. Now, it's about 24 hours because actually, when it's been timed in controlled conditions, it's actually around 24 hours and 15 minutes, a bit longer, maybe for some people a bit shorter. But we can reset that timer of our circadian rhythm through exposure to sunlight, but also through different behaviors, through exercise, through movement, and also through the food we eat. So those different factors can help to get our circadian rhythm back in track. So say your sleep might be disrupted, it might be fragmented. There are things you can do to help in train it, which include behavioral aspects like getting that light in the morning, particularly, and thinking about when you're moving throughout the day. So the circadian rhythm, it doesn't just control our sleep, though. It controls lots of other aspects of the functionings of our body. So our body temperature goes up through the day, and at night time, when we're asleep, it goes down. So our body temperature is lowest when we're asleep. Similarly, there's a chemical that's released from the pineal gland in our brain called melatonin. You might have heard of that. Now that is produced internally, and as it increases throughout the day, it brings with it increasing sleepiness. So, and that's why some people take it when they're doing a long haul flight. That's why that aeroplane's on the slide, and also you can get it over the counter. But there are varying levels of dose over the counter, so it's an interesting external drug to be taken. It's not so well regulated. So we have our circadian rhythm, but different people have different times at which their circadian rhythm might have its upswing and its downwards. So some people are morning larks, so tend to get up earlier and go to bed. So I see some nods. Others are night owls. So I'm a night owl. So I tend to kind of get up a bit later, stay up a bit later. And certainly, we do see changes with different stages of life. So there tends to be a shift to waking earlier as we get older. But everyone's different, and there is some variability. I will say I'm interested in chronotypes. Like this session today, say you were a really late chronotype, and this was starting at like 9 in the morning, you'd be less likely to come. Whereas if you were an earlier morning lark, you'd be more likely to turn up to these kind of events. So I think it's worth considering this when we're organising community outreach events like this, or even appointments with your doctor. If you know you're someone that wants to kind of attend a bit later, it's a good idea to think about making the appointment for later on. Now, I've talked about this wave of the circadian rhythm, so this wakefulness and sleepiness throughout the day, this wave that happens. But alongside that, we do have something called sleep pressure. So throughout the day, it's really sensible. You get more and more sleepy with the more you do. And it's thought that there's this chemical, it's called adenosine, and that's the image of it at the top there. That as you're going about your day, moving, thinking, doing things, more of this chemical is released internally by the nervous system into the bloodstream. And as that builds up throughout the day, it brings with it increasing sleepiness until you reach the point in this figure here around 11 p.m., where I'm suggesting that for me, at that point, my adenosine would reach such a high amount of it that my sleep pressure reaches right to the top, that then it's time, I'm going to sleep. Now, interestingly, caffeine can block the effects of that. And that's why lots of people, including myself, do drink coffee to ward off that sleepiness if they want to keep going. But if we take, excuse me. We take those two things together. So the circadian rhythm, that wave of waking and sleepiness, alongside this pressure to actually fall asleep, which builds up throughout the day. Hey, come on in. We get these two things happening together in concert. And within that, we can identify a sweet spot for sleep. So I want to talk about what happens in this spot. So throughout the day, we're busy, lots of things happen. At night time, we sleep. We're not just asleep and unconscious. lots of other things are happening, lots of functions are occurring to help restore ourselves, help with our emotional regulation, help with our memory. And I want to look into what happens when we sleep. So this is a graph that you can get after you go for an overnight sleep study. If you've seen that, when you have lots of electrodes all over you and people are measuring what's happening when you're sleeping. And from that kind of procedure, you can get this kind of graph, which shows that we go through, cycle through different stages of sleep, from being awake to going through all the way down to deep sleep, which, as you can see, happens earlier in the night on this graph. And then you cycle up and down through lighter sleep. So stage 1 and stage 2 are lighter than the deep sleep. And then later in the night, you spend more time in this rapid eye movement sleep. So that's the stage of sleep generally where you dream, where you can see that your eyes are, you can see someone's eyes are rapidly moving underneath their eyelids. So these stages, these cycling through sleep, shows that there's different functions for different stages. So earlier on, when you get this deeper sleep, that's when it's thought to be some more restoration, more healing, of getting over any kind of physical activity done through the day, some more kind of bodily restorative health. Whereas later on in the evening, when you get this rapid eye movement sleep, that's been more linked to emotional regulation, helping really process some of the things that have happened throughout the day. So this graph is a good night's sleep, and I'll explain why. There's a relatively short time someone's taken to get to sleep. So from the time the lights went out to the time they actually dived into this deeper sleep is quite a short amount of time. They also weren't awake for very much time during the period of sleep. Everybody is awake for a little bit every now and then, even micro arousals you might not even remember. But even if you get up and need to use the bathroom, no problem. You go a bit straight back into the cycles. So this person wasn't awake for that long. And overall, you can see if we added up all of the time spent all of these different stages of sleep, looks like they got quite a lot of sleep, and that's a good night's sleep. I want to now, though, compare it to what would be a poor night's sleep on the bottom. And I've put these two next to each other so you can have a look just to see, can you see any differences between the two?
Stage 3 is not as long.
Absolutely. I am going to tell you. So if anyone's got any more guesses. Absolutely. Absolutely. Yeah. Yes, I think you got it. So for a poor night's sleep, what we're going to see is, oh dear, a longer time taken to get to sleep. So even at the start, they're taking much longer to get to sleep. They spend more time awake after initially falling asleep. And overall, like you said, there's less time they've actually spent asleep. And unfortunately, people with different types of pain, any kind of chronic pain condition, we do see a much higher amount of people who are experiencing this kind of poor night's sleep. And we know that sleep is really important, not just to feel refreshed and able to do things in the day, but it's also related to all sorts of physical health, mental health, psychological health. And we do know that after poor nights of sleep, it can make pain. You can experience pain more intensely. So it's really important to help sleep for lots of different reasons, but I'm particularly interested in it with respect to helping with pain management. Yeah.
Sleep apnea have anything to do with how you sleep when it comes to pain too?
Absolutely, yeah. So we know that sleep apnea is more common in people with pain, and you know that it can cause awakenings at night time. And there's lots of different reasons why we would want to assess for sleep apnea if you suspect it. So things like if you've got a bed partner who's snoring loudly, if you're noticing that they stop breathing for short periods, and that kind of like coming back to the room type thing. So yeah, it's something to really be aware of. And speak to a healthcare provider to get an assessment if you can. So my main area of interest is in the link between sleep and pain. So it makes sense. If you've got pain, it can be harder to get to sleep because pain's arousing, keeps you awake. But we also know from lots of different studies, it's been shown that if you're not sleeping well, you're more likely to experience higher levels of pain the next day. even if you don't have a pain condition, if you're not sleeping well, you're more likely to go on to develop a pain condition in the future. Now, these are really large studies with even up to 11 or 12-year follow-ups. So lots of reasons which make me excited to get up and do this work and find out more information about this pathway. But the arrows here show that they really affect each other. So you want to find a way in. And I believe sleep is an easier thing to manage. And I'll explain why than pain can be sometimes. The other thing I am interested in, though, is physical activity and movement, because we know that the more physically active they are, it can help with that sleep pressure. It can help build up the pressure to need to sleep at the end of the day. And we also know if you slept well, you're more likely to feel motivated and to move on and to be focused on engaging in your physical activity and exercise programs. But it is a complicated equation. So I believe that if you sleep well, maybe physical activity will be less painful based on the research that I've done. But of course, we live in a much more complicated web of experiences that include things, lots of the different things written in grey on this slide. So I'm simplifying the relationships by looking at physical activity, sleep and pain, but we shouldn't ignore all of the other factors that are involved. Now, who in here does have some kind of pain condition? Yeah. So I guess it's essential to be in the room. Who has been told to move more or exercise to help with their pain? Okay. So oftentimes it is recommended. And I will say that evidence suggests that moving more can help, even when sometimes it feels like, why would I move? It hurts. And if you stop moving because it hurts, it can make it even harder to start moving again. But it is recommended to move more for most pain conditions. Research does show, though, that it's really changes between different people how effective movement and exercise can be to help with pain management. And so the work I lead is looking into whether how someone's sleeping might be changing how beneficial exercise or movement is to help with their pain management. Because we know that sleep can have an impact on how we experience pain. So if we can reduce the pain through some kind of sleep improvement, can it make us more likely to want to engage in movement that can also then help with the pain management? So that's what I'm interested in. And I wanted to describe a couple of studies that I've conducted to try and open up the work to see what you think about that hypothesis, that thinking. So the first study that I'm going to describe is focused on adults aged 50 years and above. So over half of the older adult population is thought to experience some kind of troublesome pain. And we know that if you're less physically active, you're more likely to be reporting that you have troublesome pain. And the World Health Organization produced this report, the World Report on Aging and Health, and it does state that maintaining a physically active lifestyle is recommended in order to have a high quality of life and also to live a pain-free life. But I went through this whole report and sleep wasn't mentioned once. So they didn't talk about how important sleep health might be for older adults. And sleep is rarely included in physical activity guidance as well. And I say older adults, but I'm talking about 50 years and above. It's not that old. So I was interested to look into this a bit more. And another reason for that is that these are the recommended sleep durations for people at different stages of life. So for adults aged 26 to 64, so the SASI age here, the average is the estimate is 7 to 9 hours. So we should be getting around 7 to 9 hours of sleep. But you can see the numbers above and below show there is some variability. So different people might need different amounts. So it could even be between 6 to 10. But if you look at older adults, 65 and above, they still are recommended as needing to get 7 to 8 hours of sleep a night. Although the distribution 5 to 6 to 9 is a bit wider. But what this said to me was, it's not that the need to sleep decreases as we get older, but maybe the ability to sleep does. But we shouldn't overlook the fact that if the recommendation is 7 to 8 hours, we should be doing something to help people who aren't getting that amount of sleep to achieve it. So that's what inspired this study. Luckily, the University of Michigan have been conducting this study across the whole of America, where they go to house, asking a sample of people about a range of different questions. And these questions included questions about sleep, about pain, and movement, which is lucky for me because I could get access to this data to look at if it answered the question I was interested in. When they do go to house, they do purposefully make sure they get people from a range of different demographic groups. So when they scale it up, the findings from any analysis from this study can tell us something about the whole American population. So in the study, the data that I was able to pull from this, I had data from nearly 10,000 people, and I was interested in the people who had no pain in 2014. That's when I had the data. And I wanted to go and see who of this group went on to report pain in the future, and if that changed based on how they were sleeping. Now, of the people I looked at, 52%, so just over half, were female, and they had an average age of 67. And of the 10,000 people who provided data, 1 in every 5 went on to report troublesome pain in the future. And you were more likely to report troublesome pain in the future if you had a lower level of physical activity or if you had more frequent sleep disturbances. And if you had both, it seemed like that was something that was really important. And also on the pie chart on the side here, it shows that most of the adults 50 years and above in this study report having sleep disturbances either sometimes, so nearly half, or most of the time, a third. So it's really common. So the main finding I found here, this line in red showed that the more physically active we were, the less likely you were to go on to report pain if you didn't have any sleep problems. The same as if you had some sleep problems. If you were physically active, that was good. It was preventing you from going on to report pain in the future. But if you reported frequent sleep disturbances, actually, if you were more physically active, it looked like it was more likely to go on to report pain. So maybe you were being active for whatever reason and not getting the restoration and the restorative functions of sleep you need. So it maybe wasn't as good. And overall, this was suggesting to me, oh, well, then maybe we need to not just be recommended people who have some kind of pain condition to be moving more, but maybe they should also be thinking about how they're sleeping at nighttime too, and adjusting their movement patterns to align with how they're sleeping to make sure they're getting the right rest and activity. So what I see as a balance, a bit like the wave of sleep and wake, thinking about how you're sleeping and how you're moving and making sure they're really in line with each other. Now, this was a big study, but there were some limitations. It's asking people about what happened 2 years apart, and lots of things can happen in the middle. It also just used questionnaires, which are really, really helpful, but they need people to remember things correctly, and there's only so much you can get from that. So the next study I did was focused specifically on women with fibromyalgia. Have you all heard of fibromyalgia, the condition? Yeah. Yeah, so it's a chronic widespread pain condition, often comes with sleep disturbances, kind of trouble remembering things sometimes, a bit of cognitive dysfunction, it's called, sometimes some stiffness. Now, we know in fibromyalgia, in people with fibromyalgia, that after nights of poor sleep, it can lead to lower levels of physical activity. They don't want to move more after a poor night of sleep. We also know that higher levels of pain lead to lower levels of physical activity. We don't want to move if we're in pain. But this is somewhat problematic because recommendations for the management of fibromyalgia suggest people engage in regular, moderate levels or vigorous levels of physical activity. But if they're not sleeping well and they're feeling pain, it's difficult to think, well, how are they going to start doing this and how can we help? And also, some studies have shown that poor sleep leads to higher levels of pain. That's true. But different studies have shown more physical activity leads to more pain, but other studies have suggested that physical activity leads to less pain. And again, this contradiction for me made me think, well, maybe the missing link here again is sleep. Maybe if you're sleeping well, physical activity is more pain relieving. If you're not sleeping well, maybe it's less pain relieving. So that's what I wanted to look at in this study. And this was using a wearable watch now, which measured physical activity through the day and helped us to measure sleep at nighttime. And the question I started with was I was expecting to see that after someone had a recommended duration of sleep, so based on what I told you how much adults should be sleeping, if you slept that much, the next day, if you were more active, you'd report less pain. But if you didn't sleep that much, if you either slept too short or even too long, next day, high levels of physical activity wouldn't provide the same level of pain relief. So this was the watch people wore, and we collected data over 8 days, but the first day was a day for people to get used to it. And on the watch, we also asked them to put in their pain rating throughout the day so we could track the pain. So the watch measured the movement through the day, sleep at night time, and people were saying how much pain they were feeling on the watch. So 44 women participated in this study. So we were very grateful for their participation. They had an average age of 44. So this was a bit younger than the other study that I described. And this graph shows across all of the 8 nights that we measured sleep across these 44 women, how much they were sleeping. And you can see in the highest level is 8 hours, 30 minutes. That just means that most nights people were sleeping actually quite well, but there was a range. So 400 is actually 6 hours and 40 minutes, 600 is 10 hours, but you can see people slept much less than 6 hours and much longer than 10 hours on some nights. So outside of what would be recommended. Now, this is unfortunate, but it also meant I was able to test the hypothesis to see if you were on the outside of this, would physical activity be less pain relieving? And I did find that. It matched the other study I looked at the population level, that if you slept for shorter than 7 hours, next day, if you were more physically active, you were more likely to report higher levels of pain. After longer than 8 hours, you might think longer sleep's good. But actually, if you were in bed too long, you were staying in bed. And there's also reasons why you might stay in bed longer. Maybe you've got more pain. Maybe you've got a low mood. Maybe there's lots of reasons why you're not getting out of bed, and it might not be a positive thing. And this suggested that might be the case. After nights of longer than recommended sleep, next day, higher levels of physical activity were associated with more pain. But if you step within this sweet spot, actually, after nights of 7 to 8 hours of sleep, if you were more physically active the next day, you will be reporting less pain than you would after a night of poorer sleep. So I hope I have shown in some way that my studies are suggesting that sleep is really important to consider for pain management, but particularly within the context of if you're being told to move more, exercise, engage in physical activity. I always recommend think about that within the context of how well you are sleeping. But then that makes me think, well, what can we do to help people sleep? It's very well to say you need to sleep better, but what can we do to help? Well, the guideline recommended intervention to help people sleep, particularly when they've got, so not sleep apnea, that is a separate issue, but for symptoms of insomnia, so problems getting to sleep, staying asleep, waking earlier than you'd like to, and not being able to get back to sleep. The guideline recommended is cognitive behavioral therapy for insomnia. So this is over and above any kind of sleep medications or aids. And this is recommended by the American Academy of Sleep Medicine, and it's been shown to be really effective. Now, this combines education about sleep. It combines some cognitive therapy about sleep. So if you're anxious or you've got worries about sleep and their kind of thoughts are racing through your mind, you can work with a therapist to help to kind of reframe those thoughts and thinkings and change them. And then you can be less anxious, less worried, and it can be less of a barrier to sleep. But I think the most potent parts of this therapy are two things called stimulus control therapy and sleep restriction. So stimulus control therapy is simply saying, I'm going to keep the bed in the bedroom for sleeping and sex only. I'm not going to do anything else in that bedroom because I want to make sure that I associate the bed and the bedroom with sleep. So when I get into the bed, my body's natural reaction is to fall asleep. Whereas if you go to the bed to do other things like watch TV, get on your phone, even take a rest from your pain during the day just to lie down, the bed gets associated with other things, so it doesn't invite sleep so much. Now, I do suggest if you need to kind of take a break and you would normally want to take that break in the bedroom, I suggest making a kind of rest nest somewhere in the house, somewhere else, in a comfortable chair with blankets or something that isn't a sleeping space, but really keeping that bed and bedroom sacrosanct for the sleeping. So that's essentially stimulus control. It sounds a lot more kind of fancy than it is. Sleep restriction is probably the most potent though. So this is about wanting to make sure that the time you spend in the bed is actually that you're actually spending it asleep. So say you go to bed for 8 hours and you're only asleep for 4 hours. So in a sense, you're spending 4 hours, half of the night in the bedroom, not asleep. Now, stimulus control therapy, people say get out of the bedroom, go into another room, have a dim light, read a book, do a puzzle, something till you're ready to get back into sleep. Sleep restriction therapy tries to say, okay, well, if you're in bed for 4 hours, only asleep, we want to limit the amount of time you're in the bed so we can increase the proportion of time you're in the bed actually asleep. So you wouldn't go straight down to 4 hours, but you might say, rather than go into bed for 8 hours, I'm going to go for 6 hours. And at least 4 of the 6 hours I'm getting sleep, and then that can start to stretch the sleep out, and you can increase the amount of time you actually spend in the bed. So the aim of sleep restriction therapy is to initially restrict the time you spend in bed, but with the plan of expanding it so that your sleep period within that opportunity is actually filled up. Now, cognitive behavioral therapy for insomnia is generally delivered by a therapist one-on-one. But it can be difficult to access. There's limited providers. And so people have developed different ways of doing it, like over the phone or over the internet. But there's also digital tools that can provide the therapy through an automated therapist. So somebody, it's not an actual person, it's this little cartoon figure here, this professor, who goes through the cognitive aspects, the behavioral aspects, even does a form of this sleep restriction therapy. And this company, Sleepio, they're based in London and San Francisco. And over the past few years, I've developed a working relationship with them to see if I could include this into some of my studies, as it gets this CBT for insomnia to the people that need it on their phones, wherever they are. They don't have to travel somewhere. They don't have to wait for an appointment with a provider. It's an accessible tool that can really reach people where they are. So you know that I'm interested in both sleep and movement now. So it's great. We've got this tool that can help people hopefully sleep better. And I will say it's been shown in lots of different trials to help people with lots of different conditions. It hasn't been looked at in osteoarthritis. So that's what I'm interested in. So particularly knee pain, and that's what my fly is about. But what I wanted to do was combine this sleep tool with some kind of exercise program for people with pain. And so to do that, I conducted some focus groups with people with knee osteoarthritis and sleep disturbances, including people from Detroit and Ann Arbor and Ypsilanti and surrounding areas, and included them in the development process for how we could include some kind of exercise program around this sleep program. Now, I found out a lot of interesting things through this process. Number one, people don't like the word exercise. So lots of people told us it makes them think of punishment, even at high school, where they think, well, I was made to do an extra lap or I was made to do press ups. It just makes me think some kind of punishment. They talked more about hearing words, things like motion is lotion. They like to move more, things where it felt like it was a health giving benefit rather than it was some kind of prescriptive exercise to be done. We also found out from them that they did find oftentimes when they were working with healthcare providers to help them engage with exercise and physical activity, they were often patronized, particularly the older adults, where healthcare providers, oh, you're doing really good for someone your age, was kind of in the brackets of what they were saying. So that it was really important that if we're going to be working with people to support them to move more, recognizing that people want to move more, they don't want to be limited, they want to sleep better, and they want their pain to be managed. So really meeting people where they are, listening to them deeply, and not making assumptions or talking down to them. So we did a range of focus groups. We talked about whether people wanted to go to a gym, whether they wanted a group class, whether they wanted individual one-on-one participation with some kind of physical therapist or exercise professional. But actually, people generally decided that they wanted it to be really tailored to themselves. They wanted it to be so they could use the resources that they had already on their doorstep, or they could continue to use outside of any kind of research study. They wanted to be supported throughout, but also to understand how they could be supported once the research has left. And so in the end, we've combined this Sleepio program with online one-to-one coaching over Zoom, over 6 sessions, where we helped individuals to set their goals. So what's meaningful to them? So we're not saying you need to go to the gym 3 times a week and lift weights. No, one person might be an 80-year-old woman who's got really bad knee pain, finds it difficult to stand up, but she wants to start walking her dog. So we'll work with her over the weeks to identify goals and things she can do to help her to meet that final goal of doing that walking. Someone else might be a 55-year-old man who wants to get back to running 2 times a week around the park. So he's going to have very different goals. But what we do is we help to break down the goals into manageable, smaller goals, and then help guide people throughout the course, including providing information about using social support, um, information about improving sleep alongside the Sleepio program, and checking in about different aspects of the Sleepio program, like the sleep restriction and the stimulus control therapy. So I did run a small little trial of this smooth and snooze intervention with a small number of people, and we did see that insomnia symptoms, which you measured at the start, so the start's blue, and the red line on that first graph, if you're below it, it means you've got insomnia. So you can see halfway through the study, people didn't have insomnia. And at the end, everybody cleared that red line. So no one had insomnia by the end of this study. We saw a decrease in pain intensity from the start to the end. So it wasn't as marked as the improvements in insomnia, but this was a really small study. So we do need more people to be able to get a really precise answer. We also saw reductions in fatigue, which doesn't surprise me given we're improving sleep. So that's great. And we also saw an increase in positive affect. So this is positive mood, positive feeling. We also saw reductions in anxiety, which is really encouraging, and also some reduction in depression. But again, it's a very small number of people we looked at. So we do need to do more to identify any benefits on psychological health. But the people went through this small study did say that one person said, one thing that bothers me about modern healthcare is the lack of wholeness to it. So each one thing affects the other, and that drives me crazy when I go see a specialist and stuff, and they're not taking into account the other things that I'm dealing with. So here they were talking about their sleep problems, their problems with pain, the fact they wanted to move more, and different specialists were talking about different things, and they really wanted something to be brought together. And they felt that this program at least started to do that. Someone else said something similar. It goes back to the issue of we always compartmentalize everything. So here now we're integrating 2 different aspects of what's affecting you. So the sleep and the poor movement throughout the day. And someone else said they thought it was beneficial to do them together. So the moving and the sleeping, the moving and the snoozing, that's what we're calling it, because your physical activity definitely has an impact on how well you sleep. And that was one of the aims of the intervention, was really to get people to get more insight into that relationship and understand how much control they could have over their own sleep patterns and daytime movement patterns. So to wrap up the talk, I wanted to just highlight again that both poor sleep and low levels of physical activity are very common and very understandable amongst people living with long-term conditions and chronic pain specifically. But sleep and physical activity and moving more are things that we can change, and they can help us to manage our symptoms, including pain, which can help improve our quality of life and support us to flourish in our lives. And my argument is that we really need to pay more attention to how we sleep at night and how we move within the daytime as more of a continuous related type of wave pattern, so that we can help really optimize the benefits on our pain, our function, and our quality of life. So thank you very much for having me today and for listening. Thank you. And I'd be really happy to take any questions or just hear about anything